World Health Day is commemorated globally on the 7th of April. This year's theme is building a fairer, healthier world for everyone. According to the World Organization, the COVID-19 pandemic has undercut many health gains, pushing more people into poverty and food insecurity. It's also amplified gender, social and health inequalities. The World Health Organization's Dr. Owen Kaluwa joins us now here on the Midday View. Good afternoon, sir, and thank you very much for joining us here on ENCA. It is World Health Day. A fairer, healthier world for everyone is the theme for this year's commemoration of this day. But currently, it's far from that, and the challenges of poverty and inequality have been exacerbated, especially in the health sector, by COVID-19. Dr. Kaluwa?
Yes, good afternoon. Thanks very much, and thanks very much for having me on this day where the world is commemorating the World Health Day for 2021.
So the main challenges from the World Health Organization are around inequality, and of course COVID-19 has made things worse.
For sure. And first of all, let me just say that, in fact, the World Health Day is commemorated on this day every year, because this is the day when the Constitution of the World Health Organization was adopted, and also at that particular time, in 1948, there was the definition of, by WHO of what constitutes health, which basically is not just absence of disease or infirmity, but a whole complete well-being for everyone. And in there, also the emphasis was the issue of health as a right, and ensuring that everyone has to have access to health. So this point of the theme of this year, of a healthier and fairer world in terms of when it comes to health care, is very pertinent, given what has happened with COVID, which has exposed, indeed, that the most vulnerable populations have less access to care. Not only that, but they're also much more impacted when it comes to the impacts of COVID-19 that come about by so many other reasons, including when we have to implement measures such as lockdown. So indeed, it has brought out this issue and reminds us that when we look at health, we should look at it broadly, and we should also be looking at other determinants that affect health, including poverty, education, gender discrimination, etc., that needs to be addressed as part and parcel of ensuring good health and well-being.
Yeah, Dr. Kaluwa, what should change? I mean, many countries, including South Africa, it's a constitutional right. Access to healthcare services is a constitutional right, but and governments spend a lot of money. South Africa's government budgets a lot of money for healthcare, but people are still battling. What should change in this new world where coronavirus has exposed so many inequalities?
I think one of the most important things is to look at how do we reform our health systems in such a way that they respond to the need for everyone having access. And the key concept here is the concept of universal health coverage, which talks to everyone having access to the health care they need of good quality without suffering financial hardship in the process. And that aspect of financial hardship is very important. When we want to look at how can we get much more fair access, people having fair access to healthcare, we should really look at aspects of financial risk protection. And this, in this regard, looking at things like the national health insurance, that kind of equalizes in terms of those who are able to purchase private insurance and those who have not, in order everyone to have access to these healthcare services they need. And in this broader concept, the universal health coverage calls for building resilient health systems. And in doing so, we are building health systems that can also help you to withstand the impacts or the shocks that public health emergencies that the COVID-19 pandemic bring.
Okay, Dr. Kaluwa, maybe I should have started by wishing the World Health Organization a happy birthday, because World Health Day, as you informed our viewers a short while ago, commemorates the founding, the establishment of the WHO. And thank you very much for sharing some of your views here on ANC this afternoon, Dr. Owen Kaluwa from the World Health Organization.